Since 1986, North Coast Health Ministry has provided free health care to low-income, uninsured men, women, and children on Cleveland's west side.
North Coast Health Ministry is a collaborative ministry. We rely on our volunteers, our community partners. We could not provide the services that we do without our physicians who volunteer, our referral specialists, our hospitals, the foundations, the churches, all of the organizations that help us. I think that is what sets us apart.
I'm no longer a patient through North Coast Health Ministry because after I utilized them in going to school for being a nurse, I'm currently a nurse at the Cleveland Clinic, able to afford my own insurance now, and once again, really grateful that they were there for me to get through that time in my life.
The reasons patients come to North Coast Health Ministry are as varied as the health conditions they bear. Some have recently lost jobs. Many work but don't earn enough to purchase coverage. North Coast Health Ministry is a bridge to better health for those with no other route to care.
When I lost my job and first became a patient at North Coast Health Ministry, I was in the accounting field. I had a job for 20 years and I was downsized, and then I had another for 10 years, and then I was downsized again.
Patients who come to us need a medical home. They need a place where they can see a doctor, access medication, and get the usual follow-up that they need to manage many of their chronic conditions. Many would wait until a complication happens or a symptom where they really cannot ignore it any longer, and it's clearly out of their hands. Those patients, if North Coast Health Ministry was not here, would be faced to receive that care in the local emergency departments. They would go to one of the community hospitals with their presenting complaint. They'd often be stabilized and given prescriptions for their maintenance medications and released.
In surveys, nearly all of North Coast Health Ministry's patients report that their overall health and quality of life have improved since they have become a patient. Many report that they are able to return to work as a result of the care they received.
Really, this is the most fulfilling position I have ever had. I feel both needed and appreciated by the staff and the patients. I feel that in my own little way, I'm hoping to bring a little kindness, make a little bit of a difference in the lives of people who are going through a really tough time. And I'd also like people to know how appreciative our patients are of our care. We receive cards, little gifts quite often from patients just to say thank you. And the one that really comes to mind is a patient that brought back a little glass candy dish filled with Hershey Kisses, and the card said, "This is to say thank you for taking care of me. Though I could only afford to go to the dollar store, I wanted to bring you something. I wish I could have done more." And that was so touching to all of us. It's that little thank you for the care and kindness that we give that means everything, and I can't think of a better way to spend my free time than being here at North Coast.
North Coast Health Ministry could not deliver the care it provides without the support of our network of over 150 volunteer physicians, nurses, and other caregivers.
I always have felt that we get as much back as what we give. We learn from our patients every day, and North Coast Health Ministry improves access to people that otherwise would not have access.
I think the most important thing outside of your medication is that no matter who you are, what walk of life you're from, what problem you've had, how you've lost your job or not been able to find employment, you can come here and you just feel at peace and that somebody's going to help you.